Hi, everyone. As I said, my name is Crystal Sayers, and I'm the owner of New Beginnings Health and Wellness. I'm a certified BodyTalk practitioner, and I'm also a life coach, but my main focus is on the BodyTalk stuff because we get some pretty amazing and crazy results. And so I just wanted to welcome everyone who's watching. If you're watching live on Facebook, please say hello and let us know where you're watching from. Thank you to all of our Zoomers who are watching. And for those who are watching later on, please feel free to hit hashtag replay. And this is posted on the New Beginnings Health and Wellness page, so you can actually share this on your own page or in your own groups, things like that. So tonight, here is a little overview of what we're going to be talking about. So this is going to be an amazing experiential, hopefully nice and relaxing and calming event for you while still also receiving a group session. So the first thing we're going to talk about tonight is a little bit sort of about myself and how I came across BodyTalk, how BodyTalk got started, and how the body responds to stress. And we're going to talk about how BodyTalk can actually help reduce stress and chronic pain in the body. And the other thing we're going to talk about, or I'm actually going to teach you, is a technique called the Cortices technique, which actually helps to improve brain function, and it also really helps to reduce stress and calm the nervous system. Does many, many more things than that, but I'm going to teach you how to do it. So it's only 2 minutes a day can really help improve things significantly. We're also going to talk or listen to some testimonials. So I'm going to share some testimonials from other people with you. And then we're going to do a little group session so you can experience what a BodyTalk session with me would be like. And I also do group sessions actually, and they're just as powerful. So yeah, super excited to have you. Okay. So I'm just going to grab a little drink here. Feel free that if you have any questions or anything like that, you can just pop that in the chat. If you're watching on Facebook, if you're on Zoom, pop that in the chat as well. I will make sure I take a look at that too. So thank you once again. 1 second. I'm going to be just sharing my screen with you, because I want to take you through just like a little PowerPoint to give you a little bit more of a picture of kind of what BodyTalk is about, and and how amazing and incredible it really is. I've seen some pretty awesome stuff happen even recently. Every day I get to see miracles, and I've always been a person who has contended or desired to help others heal. And not only that, but for myself as well. And what has been so amazing is the amazing thing is how the body is and can respond once, and having the healing processes initiated once we figure out where we're actually going and what the priority of the body is. And so that's what we're going to be talking a little bit about tonight. So just sit back. I want you to relax, and we're going to have a great time together. Okay. So as I said, welcome to New Beginnings Health and Wellness, and thank you for watching. You are welcome to share this with whomever you like. Okay, so we're going to just chat really quickly about how the BodyTalk system actually got started. So it was actually developed by a man named John Beltime. He is an Australian chiropractor, acupuncturist, philosopher, and author, among many other things. He's definitely been a man of study all of his life. And prior to founding the BodyTalk system, he actually contracted the Epstein-Barr virus. And what happened was a lot of damage to his body, and especially to his liver, as well as many other things. And the doctors informed him that he probably would not live as a result. It was quite severe. And so he had chronic fatigue, he had a body temperature over 100 degrees, and he was in consistent pain and had cramping. And nothing seemed to help until he came across a technique that is similar to one that is now used in BodyTalk. So 3 days later, after this particular technique was done, the amazing thing that happened was that this virus actually was completely gone from his body. This led to further research and eventually the BodyTalk system. So when applied, the BodyTalk techniques resulted in amazing outcomes for those suffering with many conditions and diseases. And this is definitely true. Okay. So my BodyTalk story, basically, I came across BodyTalk during COVID in 2020, and it was when the lockdowns first began. My husband and I had several things that we needed to shift in our lives, including selling our home. We needed to move, and there was a lot going on. There were health issues, both on his part and my part, and I was completely exhausted, and I think many people can relate to that situation where it's like if one more thing happens, you feel like you're just going to just lose your mind. And yeah, I was a mess and I really needed help. And I was doing some research and I was looking for something that was holistic in its approach in terms of dealing with the whole person, mind, body, and spirit. And I came across BodyTalk, and as a result, I started taking some courses. And within the first couple of weeks, though, just prior to taking the courses, I decided that I would have a BodyTalk session and just experience it for myself. And then I did a 1-day course that gave me some other tools to assist myself. And I definitely noticed within a couple of weeks, my stress levels decreased by 50%. And for me, that was very, very significant. And other things started improving. My sense of well-being improved, and over a number of months, some of the inflammation that I was experiencing in my body had improved. My relationships improved because I was doing better mentally, emotionally, and physically. And so my story kind of starts there, and then I was kind of sold on it, and I was like, this is what I think I want to do. And then when I started taking, BodyTalk courses, I'm like, I think I actually found my life's calling, because I've always had a desire to see people healed in all areas, spirit, soul, and body. And I just love the way that BodyTalk is just so gentle and can gently remove trauma and blockages and emotional triggers and so many different things, and even physical pain. And so let's talk a little bit about what BodyTalk is and how it works. So BodyTalk encompasses Western medical expertise. It also encompasses energy dynamics of acupuncture, osteopathy, and chiropractics, the clinical findings of applied kinesiology, and the insights of quantum physics and mathematics. So it encompasses many different types of modalities and philosophies, and forms one system called the BodyTalk System. So it's a healthcare system. So here, let's talk about what BodyTalk does. So rather than focusing on the symptom, so if a client comes to me and a client may be experiencing a particular symptom, what BodyTalk does is, or my job is really to find out what the hidden cause is of the illness by looking at the physical, emotional, and environmental factors. So in this situation here, you can see that the client's main complaint is neck pain. So they might come to me with neck pain, but it's also being aggravated by a couple of things going on in the knee, which ends up becoming the main focus of the session. By redirecting our attention, the BodyTalk practitioner then can resolve the main complaint or symptom simply by understanding the main focus. This is incredibly powerful, because a lot of times I have people coming to me, or I do sessions with them over Zoom, and many times, the symptom may be this, but actually the main priority that the body's wanting to address first is something different. And once we start resolving that and initiating the healing processes, then all of those other symptoms oftentimes will disappear, or at least are being addressed. So this is just to give you a little bit of a picture of what can happen. So, when we're born, maybe you had a difficult birth, and then maybe there was an issue with the father. Maybe the father left at that particular time. And then perhaps there was an injury, in elementary school, falling off a swing. And then several years later, as a teenager, maybe you were running, doing track and field in school, and there was a running injury, or there was this massive amount of strain put upon the body. And then perhaps at home, there were some family issues, and then you go through some more time and you get a job, and maybe your boss isn't the nicest person. And then you have a symptom, neck pain. So what this is really just showing is sort of how things can become compounded on top of each other, and then a symptom arises, which basically is the threshold. So this is where the body is actually going, hello, something needs attention, but it's not really necessarily just the neck pain, right? It could be all these other things, maybe that were not properly processed through, that actually could be having an impact on the biology of the person. Feel free just to pop your questions or anything like that in the chat if you have any. And so you have this symptom, which it becomes the threshold, and it's manifesting. Your body, the pain in the body is manifesting through neck pain, but there's other things that are needing to be addressed in order to resolve the neck pain. If at that point it is not addressed, then that can lead to further dis-ease within the body. And the body's communication systems then will start breaking down even further, and then you start having maybe potentially other health issues. And so, your whole health throughout your whole life and all of your experiences is a story that relates to how your body responds to whatever may be going on in your life, emotionally, environmentally, in every way. So let's just chat about this. So the body is designed to heal and grow physically, emotionally, mentally, and spiritually. And if all of our parts are communicating and the brain can coordinate everything, then we heal and grow. So that's the natural process. All types of stress, whether it be physical, emotional, environmental, etc., cause breakdowns in the body's already busy lines of communication. So when there is a communication breakdown, the body will adapt, but it will also become less efficient. And so then the parts forget how to work together as a team, and they start segmenting themselves. So a symptom is the last stage of imbalance, and the body is crying out for help, and it really needs to be heard. So how does BodyTalk actually work? So we've talked about sort of what actually happens, because stress is the #1 cause of most illness and dis-ease in the world today. And there's many studies related to this as well. So let's talk about how BodyTalk works. So the first little box here on the left-hand side. So in a BodyTalk session, the practitioner asks questions of the client's body to find out what area is a priority to address. So this is done using neuromuscular biofeedback. And basically what we would do if you're in person is I would probably use your hand and I would use your wrist. And so we're actually doing a type of muscle checking. It's similar to muscle testing, but we're not really testing the muscle. We're actually testing the reflex. And so it's a little bit different, but it is incredibly powerful. And so after we get the answer by asking yes, no questions of the body through a protocol chart that we use, it's quite extensive. It relates to all aspects of the body-mind complex. And we also have a procedure chart as well that we follow, so we get as specific as possible, even right down to the cell and to the DNA, RNA. And so a light tapping technique is then used to help the brain balance and restore communication within the body. So in BodyTalk, we respect the order of factors to be addressed as determined by the body's innate wisdom, or also known as the inborn knowledge. So what we're really talking about here is the part of the body, the innate wisdom of the body that basically was there since conception, that knew exactly that, these are liver cells that would, everything has its place, and all parts of the body are communicating with each other. They all need to know. Every cell needs to know what the others are doing. And so the amazing thing about this is that if you cut your finger, you don't have to consciously think, okay, I need to send white blood cells here and I need to do this, and this is the order that it needs to be done. No, this is all done by the innate wisdom of the body, or the inborn knowledge of the body, and it knows how to heal itself. So it also knows how we got in this up to where we are now, and it also knows how to unwind that. And there's a whole process to that. And in the right order and the right timing, all of those things. So then after this, we tap on the head, and the tapping is like this on the left and the right brain hemispheres. And tapping on the head, we ask the brain to fix and facilitate the changes. And what the tapping does is it actually causes an interruption in the electrical circuitry of the brain, and we're asking the brain to fix and facilitate the changes and to look for issues and to resolve those issues. So this is how frequency is very much a part of the BodyTalk system. Then we tap over the heart, which is another type of brain. Actually, they've found the same types of cells within the brain in the heart. And so the heart also functions as a type of brain within the body. And the heart stores the information. So we ask the heart to store the new information by tapping on it. And then we tap on the navel, or really over the enteric brain, which is the gut brain. And we ask the body to assimilate the changes. And so this is really over our digestive system. And as we tap on that area, the digestive system is also a type of brain. In fact, they've found that there are more nerve fibers within the digestive system than there are in our actual head brain. And all of these are types of brains within the body that need to be synchronized and work together in order to ensure healing is happening on all processes, or on all levels. Sorry. Then once the body has been reminded of the issue, it can then initiate its own healing processes. So that's all we're doing. We're reminding the body of what its job is. And so your body knows how to heal itself. It just needs to remember how. So that's a little bit of an overview of how BodyTalk actually works, and how we work with the body by asking specific questions, so we actually can find the priority and address that. And as that formula is revealed, or the priorities, maybe the brain wants to talk to the liver, and because maybe communication isn't so great there. And so we can actually improve liver function and brain function by those two being, maybe tapped out within a formula, if that's a priority. Okay, so the cool thing about this is the simple, gentle approach has proven to be so effective that BodyTalk is one of the fastest growing healthcare systems in the world today. It is safe, it's effective, and it's non-invasive. Professionals in all areas of healthcare are finding that virtually every case responds positively to BodyTalk sessions. And BodyTalk can be used on its own, or can complement other forms of healthcare, whether it be alternative or conventional. So for example, I can work with a person who has cancer, who is going through the typical Western medical system in terms of treatment, and BodyTalk would actually support the body in its healing processes and response. So this is the great thing. There's no harm done. It can be, BodyTalk can be done for babies, for kids, for animals, for seniors, for pregnant moms, for everybody. And it is a no harm type of healthcare system. And I absolutely love it. Okay. So these are some things just to give you an idea of what BodyTalk could possibly help with. We don't diagnose, and we don't make promises about certain things being healed, but our priority is about restoring the body's communication systems. And once that happens, then many of these other things the symptoms and things that people experience physically, mentally, emotionally, spiritually, can also be addressed. So on a physical level, and mental level, these are some of the issues that could be addressed. Things like allergies, headaches, migraines, back pain, prenatal care, insomnia, phobias, and emotional disturbances, stress and anxiety, depression, sports performance, fibromyalgia and chronic fatigue, arthritis, digestive disorders, viruses and infections, recovery after injuries and traumas, and many more. So many more. And with COVID, I also have worked with people who were experiencing all the symptoms of COVID, and BodyTalk has helped them to recover faster and improve their energy. And then sometimes people have had residual effects for many months after having had COVID, and I've had sessions with them as well. And many times their symptoms improve, their energy levels come back up, they're functioning at a more normal level. So many amazing things can happen. If you're just popping on, please say hello. And if you're watching later on, feel free just to hit hashtag replay. And if you have any questions, just pop those in the chats. So these are just a few examples of testimonials. I have so many testimonials, but I'll give you just an idea of a few here. So 2 months ago, I fell and injured my right arm and shoulder, and I couldn't lift my hand past my chin to brush my hair. After my second session with Crystal, I was able to move my arm over my head. For this person, that was quite significant. Another person says, I have suffered with many health issues, including diabetes, chronic fatigue, fibromyalgia, and severe back pain after 3 surgeries. I don't sleep much. After the first session, I slept for 6 hours straight and did not need pain medication for over 24 hours. That has never happened before. My energy levels improved and I felt really good, the best I've felt in years. Anxiety and stomach pain is no longer controlling my son's life. He went from not being able to go to school during the month of June 2020 to not missing a day in the fall of 2020. Let's see, there's some other ones here as well. I was sitting by the fire about a week ago and an ember landed on my cheek and burned it. It wasn't healing up and continued to seep. I had a BodyTalk session with Crystal, and later that night when I went to bed, the wound was almost completely closed and had stopped seeping. Wow, that was pretty amazing. Actually, I recently saw pictures of another BodyTalker who did a session on a boy who had a very a deep scar on the side of his cheek, and the scar was quite thick, and within 24 hours there was just a line there. So BodyTalk can even help with scars. It helps to improve the healing process because scars actually inhibit the flow of blood, lymph, nerve, and energy and communication in the body. And so, you know, it's just, yeah, it's just really incredible. So amazing. I recently had somebody, I'm going to teach you how to do the Cortices technique. And they had contacted me and they were saying that they had been experiencing severe tailbone pain for about 5 weeks. And it was about a 7 out of 10. And I was going on holidays. So at the time I was not able to do a BodyTalk session with them, but I said, hey, I'm going to send you a video and it's going to teach you about the Cortices technique. And also, it's going to teach you how to do the technique. And I want you to do this technique every day. And I heard back from this person after probably 2 weeks because I was away. And they contacted me and they said, I just wanted to let you know that all my tailbone pain is gone. And that was all they changed. Prior to that, they had gone to the doctor, they had massages or a massage, they went to the chiropractor, they were using a pressure ball as well as topical creams, and nothing was working. And so all they did was just get the brain function improving, which helps overall body function, and their tailbone pain was addressed. So this is how powerful BodyTalk can be. So many other things. So I'm going to teach you how to do the Cortices technique. So this is a great technique. You can teach this to everybody in your family. You teach this to your kids. It's great for kids, you guys. We'll talk about that in just a moment. Just gonna check on our time here. Okay. All right. So let's talk about the benefits of the Cortices technique, which I'm going to teach you. Very, very simple. It takes the body out of fight flight mode. So especially with COVID, our bodies are even more so in fight, flight, and stress response. And that can cause inflammation. It can cause an exacerbated stress response within the body and can do all kinds of things. And so this technique actually really simply helps take the body out of that place and puts it into parasympathetic, which is rest and digest. So that is what is needed in order for the body to heal. That's why sleep is so important, because when we sleep, it gives our body the opportunity to heal, because we need to be in rest mode for healing. So this helps to put us to decrease stress and get us into a more restful state. It improves brain function and mental clarity. It improves communication between the left and right hemispheres of the brain. And one of the things that happens with stress is stress will cause interruptions and will impact the brain's communication on both sides. And the other thing that happens with this as well is electronics are another example of how the brain can be impacted is through electronics, I should say. So that can also affect the brain's communication systems. And so this helps to restore the communication system within the brain. It increases a sense of relaxation and well-being. And I have to say that, after 2 days of doing this, I was doing it 4 times a day because I was highly stressed, and that was the recommendation. And so I was doing that. And within 2 days after starting to do the Cortices technique, I started noticing my brain fog lifted. So I didn't feel like I was having to get up and have a cup of coffee first thing. And then also, in addition to that, I also noticed that just my sense of well-being had improved. It's not that my circumstances had all changed, but my feeling of kind of waking up and a little bit of my mood started changing a bit. And I actually just started feeling like everything's going to be okay. And so that was a huge improvement for me within a couple days. It also helps the body and the mind process and manage stress better. This supports BodyTalk sessions as well. And the other thing that it does is it helps to warm the cold spots on the brain. So they can see in brain scans actually areas of the brain that have cold spots. And where there are cold spots, it is said that those parts on the brain relate to areas of the body that may not be functioning at optimal levels. And so if we can warm the cold spots on the brain, then we're improving not only brain function, but we're improving the overall body function, which is what we want for optimal health. Okay, so I just want to share with you a really quick testimonial. There's actually 2 here, but I'll just share one, I think, just for time's sake. So this is the power of this technique. This is how powerful it is. So this was a coma type situation. And so this person several years ago, it was a lady named Anne from Germany. And she says, I took my first BodyTalk class with Dr. Marita Kuf in Hanover, Germany. I hope I'm saying those correctly. And when I returned to my home in Hamburg, I right away decided I must try to use some of the BodyTalk techniques that I had just learned on my patients. I'm an occupational therapist and was working at the time in a coma ward at a hospital in Hamburg. I didn't know quite where to begin, so I decided to do only the Cortices technique on 10 of the patients. I then went home at the end of my shift. The next day when I arrived back, there was a terrific commotion because 6 patients had awakened from their comas. These were diabetes patients and accident victims, some of whom had been in comas for many months. They still had diabetes and they still needed a great deal of recovery from their injuries, but they came out of their comas and were immediately transferred off my wing for further treatment. So even this technique that I'm going to teach you is great. Even if, say, if you, for example, have a bump on the head or you arrive at an accident scene, this can help keep the person, their brain function, can improve. Obviously, if they're bleeding everywhere or something like that, you don't want to be touching their head, but you could well, we could talk about that. There's other ways to manage that. But all I'm saying is this can even help to prevent shock, right? To keep the brain in a better place as well. So the second one was somebody who actually heard about the first one that I just shared, and they're in the US, and they were also, I believe they were an occupational therapist as well in the US. And so they decided that they were going to try the same thing. So yes, they were in the ICU at the hospital where they work as an occupational therapist. And over a period of 7 months, this person did Cortices on 10 coma patients, and 9 out of 10 regained consciousness that same day or the next day. You guys, seriously, this is so powerful and so simple. So let's do this technique. I'm just going to stop the share. And very, very simple. With a closed hand, you're going to place it on your occipital lobe, which is sort of, there's a bump on the back of your head, just sort of where the neck meets the skull. And so you're going to place it with a closed hand. And all you're going to do is just hold it there. And you're going to take some nice deep breaths, and you're going to tap on the right and the left. So wide open hand, left and right brain hemisphere. We're asking the brain now to fix and facilitate the changes. Nice deep breaths, 2 breaths per hand movement. We're actually going to cover the whole entire brain. Okay, nice deep breaths. Tapping over the head, asking the brain to fix and facilitate the changes. We tap over the heart or the sternum, asking the heart to store this new information. And then we tap over the navel or over the enteric brain, really the gut area. And we're asking the gut to assimilate and integrate this new information. And at least 2 breaths per hand movement. And then we're going to caterpillar up again. So you're just going to kind of move one hand up. We want to make sure we don't miss an area. And you're going to do exactly the same thing. Nice deep breaths. You can close your eyes if you want to. Tapping over the head. Tapping over the heart. And then tapping over the navel or over the enteric brain where your digestive or intestines are. Nice deep breaths. And then we're just going to caterpillar up one again. And you can tap either on top. I usually just kind of tap on top, or just kind of in behind here, as long as you're tapping on both sides. Don't do this, because this is just tapping on the midline of the brain. And we actually want the right and the left brain communication to be restored. That's why we're tapping on both sides. Okay. Nice deep breaths. And remembering, every time we take a breath in is an opportunity for us to take life in fully, for acceptance. And then every time we take a breath out, it's an opportunity for us to let go. So just see yourself just letting go as you breathe out, tapping over the heart and then over the enteric brain. And you might find yourself yawning or sighing, or you could feel many different things. The yawning actually is it's just a sign that things are being released, that communication's being restored. And then we're going to caterpillar up again, and we're going to tap, and the hair always gets messy, but that's okay. It's worth it. Nice deep breaths. Over the heart, asking the heart to store the new information. And in BodyTalk, it's not rude to yawn, very much normal. So you might have little sensations or you might feel nothing. That's okay. Doesn't mean nothing's happening. The more you do this, actually, the faster your body will start responding to it. We're going to caterpillar down, right down to the eyebrows. This is your prefrontal cortex. This is our thinking, planning, voluntary movement area. So we want to make sure that's functioning well. And you're just tapping again, nice wide hand on the right and left brain hemispheres. And then over the heart, 2 breaths per hand movement. Apparently, I really needed this today. And then over the enteric brain. And then what we're going to do is we're actually going to bring our hands right up here. So the base of your hand is sort of in your laugh line temple area. Your thumb is kind of on your ear, and then your index fingers are kind of right just up on top there. So closed hands, hold for just a moment. All we're doing really is we're actually addressing the limbic brain, which is our emotional processing center. It sits underneath the temporal lobes. And this is really, really important. Okay, just hold for a second. Then take one hand off, and then you're going to tap with the other. But imagine that that hand is still there holding that. And you're just going to tap. Nice deep breaths. Excuse me. And on the navel. Then you're going to bring your hand back up there and hold just for a moment to reconnect these 2 areas. And then do the opposite side, imagining that your hand is still there and you're tapping. Nice, big, deep breaths in and out. And you can, if you're wondering, what do I think about or imagine? Just imagine that all the synapses in your brain are reconnecting, that all communication between the brain and the body are starting to be restored. So the more you can envision this, the more your body will actually respond. So our body responds quite incredibly to our beliefs and to our thoughts. And so you can actually direct your thoughts, and it can assist the body in its healing processes. And if you're just popping on, please say hello. I'd love to know where you're watching from. And we're just doing the Cortices technique. Okay, so that was the Cortices technique. So this one, I really would encourage you, if you are really stressed out, or you have a lot of physical pain and inflammation within your body, or for any particular reason, you have a loved one who is having memory issues, do this technique on them. Do this technique on yourself. Do this with your family. Do this with your kids. This is great for kids. They come in from kind of running around outside, and you need them to sit down and, maybe do their homework or concentrate on something. This is really a really great way to reset the brain, and kids respond so well to it. Plus they love, most kids love to be touched. And so it's just so great. And you can teach them how to do it. And many of them just love it because they love how they feel afterwards. Sometimes they don't have the words. And I've worked with kids, and I've heard that I've just asked them, how do you feel? And they just go, I feel good, or I feel calm or peaceful. And so so helpful. So just feel free just to share that wherever you like. And you can share this video and help to educate other people. Okay, I'm going to share my screen again real quick here. And I think there's not too much more because I want to get into an actual session. So distance sessions, lots of people have questions about distance sessions and how they work. And this is what I'm really going to say. Basically, the way that a distance session works is very similar to the way that emails and phones work. So if you have the information and the technology, and you know how to use the technology, you can contact anyone, right? If I have so-and-so's phone number, as long as I have the information, I actually can get a hold of them. And BodyTalk works this way. This is where quantum physics and mathematics comes in, and principles related to quantum entanglement. And also, so, there's the pairing of all the logical stuff. So all the training that we've had in terms of all the specifics of the body and the mind and the emotions and all aspects of our person, all of those things. So the logical left side of the brain, all of that paired with intuition and the ability to connect with another person. And this is how this works on an energetic level. I'm happy to discuss it further, but for the sake of time, I'm just going to maybe direct you to my website afterwards, and you can take a look there, or I'm happy to discuss this with you as well. So it works the same over Zoom or over the phone as it is as if you were here in person. I work with people all over the world, and the results are the same as if they were on my table in my office. So yes, so I'm happy to see people in person, but many people I can't see in person. And so most of my sessions are done over Zoom, and it is just as amazing. So yeah. Okay, so let's get into a little session here. Okay, so I'm just going to take the next probably 15 minutes or so, and I'm going to do a little group session for all of those who are watching, and those who said that they are going to watch later, whom I know said you were going to do that, you're also included in this session. So this is the cool thing about energy medicine and energy work. And, we can include those, even if you're watching later on, those who maybe you didn't know about the meeting, you actually can still get the benefits. If your body resonates with the items that are coming up within the session, your body will actually get the benefit once we do the tap out as well, because we're dealing with frequency. And so issues with space and time and quantum physics don't really, time is not really as much of a factor as it is a lot of times in our Western world belief. So that's all I'm going to say about that. But let's just move on to the session. So I just want you to get really nice and comfortable, and maybe just move your neck. Don't move to the point of crazy pain or anything, but just notice if there's any tension. Okay, so just moving up, moving down. You can lean over, stretch your back, check your arms. Is there any tension there? You can lift your arms right up and see sort of what's the movement like on your arms, that type of thing. And is there any pain in those areas? So you can just check and see sort of where the discomfort might be, or the point of resistance. And don't push it back there, just see where it's at. And we'll check it out at the very end and see if that might have changed for you. Okay. So what I'm going to do is I'm actually just going to just take a moment and just kind of just focus. And I'm looking at the whole group as a collective. And basically, we're going to see what is the priority. And yeah, so nice deep breaths. I'm just going to close my eyes just to help me concentrate for a moment. Okay, so I'm kind of just sort of zooming in on the group here. So the first thing that's coming up is some things related to the brain. So I'm just going to write down brain. I'm going to take some notes as we go along. So we're focusing on the brain, and basically I'm asking questions. So if you were here in person, like I said, I would be holding your wrist, and I would ask questions, and I can actually feel the lightness or the heaviness based on the yes or the no. And so that's similar to what I'm doing here in person, but I can use my own arm and it will work the same. So that's the really cool thing, because we're all actually connected. Okay, so we're going into the brain, and it is more specific. We're actually addressing the limbic brain, and it's the middle of the limbic brain. So this is sort of where the amygdala and several other areas, the limbic brain relates to our emotional processing. And so the limbic brain is all about survival. And that's where sort of that fight, flight, freeze response can come in. And so we're actually going to address some communication areas here in the brain. And like I said, in Body Talk, all we're doing is we're reestablishing communication between the various parts that are the priorities. And that will actually address and help with getting the healing processes happening for optimal health. Okay. And there are some details on this. This is being oriented to time, and it's related to current time, so to the present. So time is is a kind of an external factor, so it's an environmental factor, and so we can feel time pressures, things that have to get done, all that kind of thing. Or there could be so many things, but I'll just see if we need more details on this. No. So just all areas related to the current time, we're actually going to address how that may be affecting the body so that it doesn't affect nearly as much. This is really, really cool. It's also being oriented to people. So people as an outside factor, and to work. Specifically working from home or working at home. So whatever work is to you that relates to your home. So that could be, for some people, that's washing the dishes or cleaning the bathroom, or maybe you have an office in your home. So it could relate to any of those items, but working from home. What is coming up specifically, though, around this is the office. So the office being a factor that may be actually impacting. And again, there's no diagnosing here. This is just related to, on an energetic level, how sometimes things can possibly affect. It's really about our perceptions and our beliefs about those things that actually impact us, not the actual item itself. So let's see here. This is being defined by physiology. So a definition is something that is internal. So the physiology relates to the function of the middle area of the limbic brain. Okay. And part of this relates to sort of maybe being overstimulated. And so part of what we're doing is we're addressing we're addressing this thing related to being over the limbic brain being overstimulated, so that it actually can calm down and respond, at a more synchronized and balanced level. Okay. So all right. Further on this, no. So there's no further. That's kind of our one item, is the limbic brain. And there's a few things underneath that could be actually impacting this area. And so we want to resynchronize that. And now we're actually linking this and connecting to something else. And specifically what's coming up related to this is the pancreatic reflex point. So the pancreatic reflex point is an area. What this technique is an area that relates to the pancreas and the digestive system. But what the technique itself does is it actually helps to address blood sugar issues. So if you're a diabetic, I will just tell you this right off the hop. Just keep an eye on your blood sugars and don't assume business as usual. Make sure, if you are a type 1 and you have insulin, don't just take your normal dosage. Make sure you're checking beforehand, because the body will actually want to resynchronize, and so it may be slightly different. So don't be surprised if your sugars are a little bit different, because this is actually to help resynchronize the blood sugar levels. It also helps for better function and communication within the pancreas, but also the pancreas communication to the digestive system, and just kind of reconnects all of that. The other thing that it does is, how we did the Cortices technique. Cortices technique helps to improve brain function, and which helps to improve the body. This one is sort of like an overall body tune-up, just like we did with the Cortices. And it helps to resynchronize the left-right mind to the left-right body. So it's kind of like a resynchronizing shift there as well. So this is a really, really good one. It can be really helpful for people who have mood swings, especially due to food and sugar issues. It can help with PMS, so women's reproductive cycle issues, things like that. So this technique is good for that, plus many more, but I won't go into that. So there are details on this one as well. And this is being defined actually by the element of fire. So in Chinese medicine, the element of fire relates to maximum expansion. So it's about expansion and about movement. And it's being defined as well by the emotion of anger. So a definition just means that it's something internal, and we're actually resynchronizing the emotion of anger. And anger isn't all bad. Anger is relates to helping us see that there's something that requires action, and we need to take action. But when it becomes sort of unprocessed, it can get stuck in the body, and it can lead to many different issues. And so we're actually going to address and release any anger that isn't serving the body. Okay. Specifically, it's like low-grade anger. It's like frustrations. So things that are frustrations, and it just helps to sort of de-trigger some of those things so that the emotion isn't getting stuck. Because that's the other thing that can happen within the body, is when we experience things and we don't fully process them, the body, it gets trapped within the body somewhere. And so different parts of the body can be affected. And once it's released, then those areas can have better health as well. Okay. It's also being defined by consciousness. So consciousness relates, this is a pathological consciousness. So it has to do with limiting belief systems. And we're actually addressing a belief system around decision-making and the fear of what people think. The fear of being judged, I guess, by other people. So as we address a belief system, when it comes into our awareness, it means actually the body can release it, because we're being a witness to it. And that's all that's happening here with, as each of these items come up, is we're just being a witness. And as we are being a witness, it actually allows the body to release. And so if these things don't affect the body, you might find you think a little differently, or you feel more confident, or maybe something physically has been addressed, or even maybe emotionally, you feel better. There can be so many different things that can happen in a BodyTalk session. So powerful. Okay, so let's see here. So fear of judgment. See if there's anything else on this. No. But there is another aspect of consciousness, and it relates to time. So this is around sort of our beliefs and behaviors related to time. I'm actually just going to look this one up because there's several, and I'm going to check and see which one is it that we're actually addressing. We're actually addressing behaviors and beliefs related to personal struggle. And as we're addressing this, really what we're moving toward is the whole aspect of being able to just accept what is as it is. And when we are struggling to accept what is as it is, not that we need to resolve that we will stay there, but when we struggle with accepting what is, it actually can keep us very much stuck, because we can't move forward. because we can't accept what's happening. So it's like we can't take life in fully. We can't even enjoy the sweet things of life. So it can have so many bearings in many different areas. And once, as we're releasing this, what it does is it's going to allow you more ease to accept what is. And once we can do that, it actually gives us the ability to move forward. So I'm super excited for you. So movement with ease through life. And then we're actually going to tap this out, but we have a specific hand position here. So I'm just going to check and see if we're doing this one. We're going to do the pancreatic reflex point. So this is a fun one. Okay, so we are connecting, reconnecting the communication between the limbic brain, okay, and the pancreatic reflex point. So this technique related to the limbic brain can help reset some of that stress response, fight, flight, freeze response. And then we're connecting that to the pancreatic reflex point, which helps with blood sugar levels, managing blood sugar levels, our digestive system, our ability to digest life and to process life, things related to the decision making and the fear of judgment. We're resynchronizing that so that's not actually affecting or has such a bearing on your decisions. So you can make decisions with confidence, and then accepting what is as it is. So those are our aspects for tonight. So I'm going to stand up actually for this because I need to show you. So on the left-hand side of the body, sort of, if you take your right hand and put it underneath your armpit, down where your pinky finger is, and just a couple bits forward here. If you push in there, you will see it's painful. And if you're going to just massage that a little bit. So I'm going to have you take part in this. So if you're watching later on, do this. This is really good. It's going to be great. So you're just going to kind of massage that. And if it's sore, you will notice. And it definitely probably means that you needed this. So that's good. And if it doesn't feel sore, that's fine too. You're still going to get the benefits. So you're going to hold that, and then I'm going to massage the other side, and I'm going to do the tapping. So you just take that and just stimulate that area a little bit, even though don't make it really uncomfortably sore, but just challenge it a little. Let's put it that way. Okay, so you do that, and then I'm just going to actually challenge this other side, and I'm going to have you take nice deep breaths. So this is tapping out the formula. This is like installing a new program on the computer. We're actually giving your computer system an upgrade. Nice deep breaths. You're still challenging that area. Tapping on the head, asking the head to store or to fix and facilitate the changes, asking the heart to store this new information, and now asking the digestive system to assimilate and integrate the changes. Okay. Okay, so nice deep breath in and out, and that's just a little sampling of a session, but what I want you to do now is I want you to check and see if there's more or less tension in your neck. I notice less actually for mine. Definitely a little more movement. Same thing with the arms. You can test that. Just raise your arms and see sort of where are you at with that. Bring it up and out. Bring it straight up. I have a little more movement actually. It's less tense. And then out. Yeah, lots more. So that's me. Tell me about you. What changes have you noticed? Just a couple of things just as we finish up here. You might, like I said, you might feel a little bit different. You might feel tingling, you might have a little tear, you might have a little sinusy kind of thing releasing, you might be yawning, those types of things. Those are all good. They're indicators that your body is just responding. And if you didn't feel any of those things, that's okay too, because everybody's body is different. So it doesn't mean you didn't get the little session. And if you're interested in a full session, I would be happy to just book a consultation, no obligation, just to chat about your health needs. And you can send me a message through Facebook on my page, in our Facebook wellness group, New Beginnings Health and Wellness. You can join that group. There's all kinds of things tomorrow morning, Wednesday mornings at 11 a.m. Mountain Daylight Time. I have Ask Crystal, tell me what my pain is trying to, or ask Crystal, what is my pain trying to tell me? And really, this is about just understanding some of the deeper issues and things that our bodies actually might be telling us by mirroring pain in certain areas. And this is incredibly powerful. It can help bring a whole new level of awareness and can help you move forward and heal faster. So I really want to encourage you to join us 11 a.m. Mountain Daylight Time in the Facebook Wellness group. And you can also reach me through my Facebook, www.newbeginnings with an S on the end, HW, which stands for Health and Wellness, .ca. So New Beginnings, www.newbeginningshw.ca. And yeah, feel free just to get in touch. And like I said, I'd be happy to chat with you about what you might be dealing with and see if BodyTalk is the right fit for you. Okay, have a wonderful evening, everybody. Take care and let me know how you do with the cortices. Do it every day for a week and see how you feel. I'll bet you will notice a difference. Okay, take care. Blessings. Bye for now. I'm going to stop the recording.